So thank you, Dr. Sajias, for presenting me. Honorable chairpersons, a very respectable Professor Ghulam Rabbani sir, as well as Professor Moner Khabor sir, and the first National Scientific Conference on Psychiatry organized by Bangladesh Association of Psychiatrists. Thank you very much for inviting me to give a talk on the very important topic for integrating mental health care into the non-communicable disease agenda, Bangladesh perspective. I am Professor Mohammad Rubaid Amin, although I am not a psychiatrist, like a psychologist, but it's great to see all the psychologists and psychiatrists of our country and also the emerging psychiatrists that is evolving in different locations of Bangladesh. It's a great pleasure actually for me to come over here because it's an observation that one of the best people are actually doing tremendously good job on the part of mental health, making it the awareness at the same time doing a lot of activities for progressing this important issue in the next subsequent years. So what I'd like to say something about is the non-communicable disease agenda and try to making something about how shall we make the integration of the mental health care system in the Bangladesh health issue. I will be starting with a slide that is a black and white. It looks like a little hazy because the mental health issue was a little bit hazy in our country, if you can agree with me. Then I found that there's one book known as the Rollage Handbook of the Psychiatry. And our honorable chairperson is over here, Professor Ghulam Rabbani sir. This is his paper associated with also Helaluddin Ahmed. To see the picture, what is actually happens in our country perspective of the psychiatry in Bangladesh. He gave an arrow actually, how shall we progress. And surprising that we started the process in 1957 when an institute in the Pabna was developed, the Pabna Medical Institute, as we all know it. But surprising is that since then, it takes around 20 years to develop the post-graduation of the courses in our students. Can you imagine? It takes 20 years time for a very important health issue that is we are seeing. And then there are many steps are actually there, and later on they were predicting that in 2021, this means this year, we can integrate the mental health into our primary health system. So you see the dreams actually started from the long, and thank you Helal for giving us this picture, and we can see that what is the trouble of the mental health issue in our country perspective. In between, there is a National Institute of Mental Health developed, and you see after the 50 years of our independence of Bangladesh, we are still saying there are two institutes of the mental health care. One having a 500 bed, another is supposed to be 500 bed. So is it enough for a country of 17 crores? Absolutely not. And the last circle that has been showing that amount of money expenditure to the mental health illness, for 100% there is allocation for health, it is 0.44%. That is a shame to be said, isn't it? Then again, I will be giving a highlight that what happens by our honorable teachers of the psychiatrists in our country. They had a tremendously good job starting in 2015. I collected this picture to see our honorable teachers in the name of the Ghulam Rabbani sir, Mohit Kamal sir, Farooq sir is there, and Wajul Islam sir, who is supposed to be my previous speaker. Tremendous job. I mean, within the sphere of the year, 4 months in 2015, if I am not correct, I think they have 5 or 6 meetings within this short period of time to develop a mental health policy. Although there has been an act developed and enacted before, but that is the time where the pace started developing the mental health issue in our country perspective. So thank you, I just collected this wonderful picture of them. Then another milestone was developed by the Non-Communicable Disease Control Program of Bangladesh, DGHS, because one of the components is the mental health, to have developed a mental health survey in 2019. I would say it's a wonderful paper that has been published in the Bangladesh Journal of Psychiatry in 2005 and 6 actually, and it actually shows a lot. It's a very busy slide, I'm not going to say anything about that. But the issue is that for the adult as well as child, not only the part of urban, but also in the rural territory, not concentration on the part of any sex issue, the study was very important. Important in the respect that now at the same page we are telling we have 18.7% adult having some sort of mental illness in our country. Now we are all saying the same page that 12.6% of the children is having some prevalence of mental illness in our country. We are saying at the same tone that 92% have in treatment care. Unimaginable, 92%. We can imagine around 50% maybe a gap there in a country where there is no development. But it's 92. And what about the workforce? Unfortunately, we still have only around 270 psychiatrists, around 565 psychologists. We don't have any that kind of infrastructure. There are a few hospital bays, but unfortunately, community-based healthcare system for the mental health is not there. But there are some good news at the same time. The way forward was we have developed a Mental Health Act in 2018, and also there are some drafting of the strategic plan of the mental health, as well as the cost reduction plan. The policy of the national mental that has been shown in the picture previously is also completely drafted. We are about to finalize having this in front of us. This is good news. I just want to give you some situation analysis of mental health in Bangladesh, thereafter what we have done and what way forward. Now there has been one published paper by Mr. WHO which shows that when we are concentrating about the national mental health policy and plan, has we incorporated in our document about the primary healthcare integration or not? The answer is yes. Has we make it that we need to decentralize? The answer is yes. Unfortunately, in our plan, we have not addressed the maternal issue too much. That is a big gap actually there, according to me. We are not sure whether the seizure disorder or epilepsy there is whether it is concentrated should be proved in the part of the policy or plan or not. Unfortunately, it is not there. But we address rest of the things in our policy as well as plan, which is a very good news. Because when you have documented things in your policy as well as in your strategic plan, you have made a cost reduction plan, then it really, what you need is to implement it in the field. About the doctors, we have a 20,914 human resources, rate per 100,000 is 12.9. This is the nurses situation that was presented in that part. Unfortunately, they said there is a psychiatric nurse cemetery, but I'm really afraid this is statement true or not. Because the nurses who have presented has some sort of training, but to tell a psychiatric nurse is a different issue. I think we do not have any such amount of 700. Still then, rate per 100,000 is only 0.4. We have only 0.2 per 100,000 psychiatrists in our country. We do not have any psychologists, that is only 0.5 per 100,000 population in our country. Even for the social worker, we don't have. Recommended social worker is not there. We have 2 mental institutes, per 100,000 beds it remains 0.3. For the general hospital that we have, all in our country perspective, we also have 0.3 beds per 100,000. Unfortunately, a big issue of the forensic unit is very crucial in many of the components. Look at the number, it's only 0.01 per 100,000 bed. We do not have any high quality residential care facility. Child adolescent is a different issues and it has the facilities of poor structure. Hospital mental health is not available. Community based in-hospital service not available. We do not have any alcohol, drug-related facilities still not available. I mean the bed per 100,000 and child adolescent other facilities. So you still see what we need to do is to, even we do not have any infrastructure, human resources. And about the facility checklist, there's a surprising that I told you about the psychiatric nurse 250, but they are not actually psychiatrists. So what we have done from the NCD-OP component is that there are global indicators in the form of suicide mortality rate. You all know that. We have done few of the ongoing activity like 85 days training, 5 doctors have been trained from the NCD, 28 days training, 10 doctors in 1 batches, and 28 days training we have completed 30 nurses in 2 batches. We have done a lot of training on the part of mental health in the 3 days training in the Upazila Health Complex for doctors as well as nurses. So the good progress has been done that we have conducted the survey. We had the mental health policy almost developed, about to be finished pretty soon. National Mental Health Act 2018 has been enacted. Strategic plan 2020 to 2030 developed and awaits for the approval, right, just about to be completed. We have had a neurodevelopmental disorder 2016 to 2021 developed. Only country in the country that is selected part of Global Mental Health Initiative by WHO. We also developed many of the ICC, BCC, TV, sport, audio, visual content module, as well as guideline. This has been developed by the NCD. Adoption and transition of the WHO image gap module has also been there. There are hospital service management. They also done few of the hospital-based 8 district hospital activities in the form of Shishu Vikas Kendra. But we have a lot of challenges in front. Like we do not have a dearth of the mental health expert.
About the undergraduate medical curriculum, it has been there, but what about the postgraduate curriculum? I'm not sure this is too much addressed for the other issue or not. And there are non-homogeneous distribution of mental health human resources in the services. There are coordination problem, there are effective ownership problem in the management. So we have a lot of plan actually in the short term, you can see the mid term or the long term. The main goal is to maternal health care, inclusive primary health care at both rural as well as urban maternal health activity should be there. This is our aim goal up to 2030. The big, fortunately, are to say that the urban is there with the big issues of good infrastructure, but unfortunately, in my opinion, non-communicable is a big problem of the mental health care service in the urban population. You can see people are going to the private practice, people are going to the different hospital, but are they getting enough care for the mental health or not? A big issue. Rohingya refugees is another issue. There are many national protocol has been there for the hypertension, diabetes going on, but what about the mental health? Are they getting the same sort of guidance or guideline by our national procedure or not? Last of all, WHO special initiative for mental health is being importantly taken up by us. We are one of the countries initially to be involved, first of the 6th country. Initial kick-off meeting, you can see our honorable advisor, the daughter of our Sheikh Hasina, the Prime Minister of our country was actually there. It's also led by her. WR was there, WHO CRO, our Director General Health Services also are very honorable, respectable mental health services. Now the important part of this important initiative of universal health coverage of mental health is that 1 billion more people will get benefited from universal health coverage. This is very important. 1 billion more people will be supported during the emergency of mental health. 1 billion more people will enjoy better health and well-being through this process. So this is a fantastic. And they have many of the strategic action plan. I'm not going to be detail about this thing. But our problem is that we need to have coverage to release the treatment gap around 50%. We need to reduce the suicidal rate around 15%. Vision is very simple. All people should achieve the highest standard of mental health and well-being in our country. Now let's focus on the part of COVID-19. As you can see, this is another area where the mental health should become the highest burden of the problem in our, not on the globe, but also in Bangladesh. And wearing masks, is it a social distance or making a mental distance between us is a big question. And what we have done in the NCDC, we try to make these things to have a guidance of mental health and COVID-19. We have a guidebook. We develop some of these material like the standard operating procedure to give a telemedicine services of the mental health. And also we have done a COVID-19 প্রাদুর্ভাবকালীন সময়ে মনোসামাজিক ও মানসিক স্বাস্থ্য বিষয়ে বিবেচনা বিষয়গুলোকে নিয়ে গিয়ে একটা অ্যাড্রেস করা we have done it. Lots of the simple tool like this has been there, like সারাদিন করোনা করবেন না জীবনের অপরাপর বিষয়গুলোকে প্রাধান্য দিন. You can see simple message, but it gives a serious impact on the part of general population. And people are remaining in the home. There are some advices for the home. People having some problem with the sleep. There are some advices going on through the sleep, through this wonderful team. We also have done many of the issue for the children, what to do for the children on the left side you can see. And in the middle time, we have a lot of autism and neurodevelopmental disorder. In this COVID-19 arena, what they should do has been given this, we have done it. On the right side, you can see also the WHO based some of the important idea that has been told. For the adult, we also have some sort of leaflets and as well as messages there. And very recently, we have done another one, which is called the media's coverage for the suicidal things. This is a wonderful guideline that we also have. আত্মহত্যা সংক্রান্ত দায়িত্বশীল সংবাদ পরিবেশনার জন্য যেসব নির্দেশনা থাকবে তার জন্য কিছু আপনার গাইডেন্স দেওয়া আছে. So that's the things we actually done. So what next? What next is important that we are telling something about the primary care integration. We need to do it. We need to start it by somehow, at least 2 upajala, 3 upajala. We should start to develop the para-counselor, try to non-pharmacological intervention of the psychiatrist, also doing some of the pharmacological intervention in the Upajala health complex. We must start it. We have a lot of psychiatric medication in the form of antipsychotic, antidepressant, anxiolytic, mood stabilizer, anti-epileptic. These are helpful. These are wonderful drugs. We should not be stigmatize the drugs. That is very issues in our country. That somebody is taking the antipsychotic, it's as if like they are taking some suicidal thing. Absolutely wrong. Drugs helps. Drugs helps a lot of mental health disorder. So we should incorporate these things to the brain of our physician as well as the general people's mind so that the psychiatric medication really help our mental health disorder. We need lots of psychosocial intervention. People like GO, NGO, all need to come together if you want to really help in this respect. Health information system, very poor. We are very poor in the DHIS. There's the DHIS system, but we do not have any reflections over there. How many of the people are actually having this? We have all the estimates in our hand, but we do not know actually what is the number, what is the figure, what disorder figure, what are the stress figure in our country. We do not know it. We need to work a lot on the part of the NCD in this respect. We are very happy that mental health has been in the undergraduate, but I'm afraid in the postgraduate course we need to incorporate more and more, because it's as if like that people who are going to read out the psychiatry in the postgraduation only need to know something about mental health. But this is important for every spectrum, for everyone. So every specialty should have something about the basic of the postgraduate mental disorder, according to me. And importantly, it's not only a health issue, the issue should be a social cultural factor where the family network, community support, stigmatizations, and something innovative planning is there. And not only the part of health, there should be non-health sector activities in the form of education system in our country, child development system in our country, and the criminal justice system already. But the good news is that our previous director with us, Wazirul Islam sir, our new director with us, and they are saying that Bangladesh needs to include religious leaders, school teachers, and local government opinion leaders in promotion of mental health and early detection and prompt management. And our Director General Health Service says, with the current initiative and future plans, the mental health and psychosocial service in Bangladesh are expected to gain new momentum. And with this hope, I'm just going to finish my talk with saying that for the last few years, there has been seriously good momentum happens in the mental health in our country. All we need is to carry out these things in future. We need at least establish the integration of mental health care in our primary health system, not only the part of the rural area, but also in the urban system. Few pictorials for you, where our honorable advisor Simon Hossain is there during the time of planning. The mental health day we have already established a plan. Very recently, a special initiative for WHO mental health has been there. Our honorable health minister was also there. Few of the pictures where the workshop, the trainings, and the mental health image gap trainings and many long trainings are going on. And hopefully things will be more brighter in future. With these things, thank you very much for giving me the time.